Good afternoon, everybody. It's a wonderful Friday. Welcome to the Real Talk Show. I am your host, Malungo Mwanga, and today we are continuing our journey on the road to the RAHi. And today's topics are they are amplifying adolescents and young people's voices in the DAHis. So many DAHis have been going on lately, and we are going to talk about them because they've been amazing shows. So joining me are three incredible guests. The first one, who is Charity, who is a public health nurse and has been working closely with adolescents and young people from Kalomo and Zimba. We also have Mr. Vincent, who is a community facilitator and has been engaging with young people in Chipata. Today we are so spread. Kalomo, Chipata. And lastly, we have George, who is a communication officer at the youth platform and has been the main organizer of the DAHi, RAHi, PAHi. Bro, you're doing so much right now. And most importantly, our sign language interpreter, Chancer Shadrach. Welcome to the show, everybody.
Yeah, thank you. Thank you.
Okay. Firstly, before I even start having conversations with you, I would love to boast and say that I attended the DAHi that happened in Mansa. That's something that I'm so proud of, and I hope that no one has attended the DAHi so far, so that I can be the only one who's excited.
Uh, you can look at my T-shirt. You
Oh
can
my
look at my
God!
T-shirt.
Oh my! You just had to bust my bubble. You just had to bust my bubble. Anyway, let's dive right into it and we talk about our main topics at hand. I'm going to start with Charity. Charity, so you were a public health nurse. I know. So, what exactly inspired you to champion the cause of adolescents and young people at the Kalomo DAHi? Since it looks like we all attended DAHIs at this point.
And sorry to babble. All right. So, so I would say an opportunity or an inspiration came in because most of the times I'm being found with these adolescents from morning till that's my everyday thing. And
Yeah.
attendance to the high, I wanted to get as an insight or more knowledge on what could be leading to the many causes of cases that we have at the facility concerning the
Yeah.
adolescents.
It's amazing that somebody who actually works in a health facility is able to attend the high because you guys literally have first-hand information.
Yeah. Okay. Yeah. So like that was a very good opportunity because
Or
it
what's on the
yeah.
ground in case as the adolescents want to. The net Airtel is back at it. Anyway, yeah. So Charity, I just wanted you to give me a short explanation of what exactly you learned from the adolescents in Kalomo in Zimba at the DAHi.
So from the Kalomo adolescents in Zimba, they were able to express their concerns and the problems that they have. They wanted a linkage between them and parents. They said parents are not involved in this fight. They are well.
Are you still with us, Charity?
Yes, I wasn't just able to get what you were saying.
Oh, okay. Sorry. I thought it was Airtel again. No, you can go on. You can go on. You can just share with us what exactly was learned at the DAHi.
Okay, so at the high, yes, like I said, adolescents were able to express themselves, what concerns they had, and the recommendations that they wanted. They said they wanted a linkage between them and parents, the communication barrier to be broken down. They said culture is still playing its part, that parents are not able to express themselves in terms of sexuality and helping up with the talking to these adolescents.
Oh yeah, parents. I know we have some parents here, but I won't point fingers. Let your children be free. No, but that's a very valid point. I feel like most adolescents are not free to even talk about some of these things that we bring to them at the DAHi because of the backgrounds that they come from, and they don't have that space to actually do that. So I love that there is that consent. Adolescents are thinking, yeah, they are really thinking.
The
Yeah.
fear
Yeah.
of hindering them. If they come out, parents would feel like it's a taboo for a child to tell their parents to say, no, how'd you put on a condom, something like that.
Yeah, when at the end of the day, they gotta protect themselves because the generation that we live in, we can't avoid certain things. So we have
Sure.
to just teach them.
Yeah, that's
Yeah.
true.
So, Mr. Vincent, you are a community facilitator. Yeah.
Yes, yes, yes.
Okay. So, can you just tell us a little bit about your work with adolescents and young people? Since when we look at the fact that you deal with the community, there are a lot of young people in that community. So, what's your
Yeah.
work around that?
Okay. So, thank you very much. Our work or my work in the community is to make sure that adolescent and young people have the access and the HR, sexual reproductive health services, and also they're able to identify the threats that they can face or they're able to encounter as young people. So we are as community facilitators, we're working hand in hand with the facilities near our catchment area, so that we become a link between the facility and the adolescents, the young people in the issue of accessing the services. So basically, that's what we're looking at, and also trying to promote the intake or outtake of the family planning. So because you find others they are looking at the issue of you may find your auntie, your uncle to the facility when you want to access the family planning. So as community facilitators, we are there. So we are like a link where we can also refer, also give services to the adolescent and young people. We can also engage the community uh, outreach person so that they can
Yeah.
also give the family planning services in the community. So that's basically as a community facilitator that we usually do, and that's what I do. It's like a link, it's a bridge between the adolescents and the health services. Thank you.
Okay, now talking about adolescents, as adolescents are really difficult. So, how do you really manage to just make sure that whatsoever you're doing is giving a positive difference in their lives? Because I might be coming and listening to you, but I'm not doing what you actually tell me to do. So, how exactly do you make sure that it gets
Yeah, you
positive?
know, as a community facilitator, you need to be a role model. That's the first thing you need to do. You become a role model, then you lead by example. So if it will give a reflection that I want to have access of services through a clinic, but if you look at you are the one who's in front of impregnating young girls, you're in
Yeah.
front of doing most of illicit behaviors, automatically you are not going to be a reflection so that adolescent and young people have access to or to have trust in you. Also, you need to be an open-minded person, not because you see an adolescent engaged himself or herself maybe in a sexual activity, then you start judging. So mostly we are open-minded, and we keep secrets. So we that's what makes adolescent and young people to come through, so that we link them to services.
Yeah, there's one statement that you've mentioned where you said as the older people, not the exact words, but you meant as the older people, I think we're the ones who are supposed to create a path for these young people. It's reminding me of something that was talked about at the DAHi in Mansa, where they were actually discussing the main causes of teenage pregnancies. And one of them talked about sugar daddies, the older men actually. And youths were able to just bring that out and say, okay, most of these young people who are getting pregnant, you follow the people who impregnated them. They are these same people who are supposed to protect us. So I think it's important that it was said and it was expressed to them that older people are supposed to be protecting the youth rather than making them make bad decisions.
Yeah,
Yeah.
even yesterday in the high in the high in Chipata, It's the same thing that came out where you find somebody who needs to protect you, somebody who needs to guide you to become a better person, a better adolescent, is the person who's coming to say, you look attractive.
Exactly. Exactly.
Yeah.
How do we progress like that?
Yeah, we can progress, and we cannot manage to fight these diseases that are just intergenerational relationships and these other communicable diseases. So we need as these big people, elderly people. They need to make sure that they have that remorse in them where they have to protect a girl child, to make
Yeah.
sure that when they see a girl child, they don't see chakudya ati no kamwana kaoneka kavala skating ngono no kaoneka chakudya.
Imagine.
We need to protect and safeguard the young boys, the young girls, so that we have a brighter future. Yeah.
No, thank you so much. George, I'm seeing so many smiles there. What's making us smile today?
No, I just like what is being talked about, because
Yeah.
I think it's also coming out in each and every DAHi and reports that we are receiving. So it's a quite common issue that is being raised so far. Yeah. So I'm smiling because I'm agreeing to what everybody's saying.
Yeah. So, you being the communications manager, I'm here for you now. I'm here to you. You are the communications officer actually at the youth platform. So, what's the biggest misconception about adolescents and young people's engagement in health conversations that you've heard about, or rather that you know of?
Well, thank you so much for that question. So the biggest misconception is that adolescents and young people aren't interested in their health or having a healthy conversations with powers that may be. So these DAHis are simply, how can I put it, a platform for them to challenge this and to challenge the authority, to tell them, to say, young people are actually ready to discuss this issue. I heard what Charity had raised to say one of the issues that came up was that the young people are asking the caregivers, the parents and the authorities to say, please, we can't reach our parents. We would like to talk about sexuality and other issues, but we cannot reach our parents. How do we do this? Okay. I actually attended that DAHi as well. Very interesting things came out. So that is the biggest misconception. So the DAHis are there to simply give a platform for young people to share ideas, share experiences, their problems, and all the other issues that they are faced with. I think it's important to it's also another way for the ministry and the officials to tap the information from the source. That's why we're calling it the District Adolescent Health Indaba, where we are listening. Okay, how do we work together? Yeah. That's what I would like to put out.
That's amazing. That's amazing. And from the way you're explaining, it's like you have, I won't really say experience, but it's like you know something. So me viewing that, I would really want you to share any success story from the DAHi's event that proves that young people are invested in their health and their well-being. Any success story that you heard of.
Any success. So the first thing is the turnout of the young people. I think for me that's a success. But the most important one is the participation and the openness and the willingness to put the policymakers to task. Okay, to say this is our issue. We don't want to talk about it, but move it forward so that we can have solutions. So to me, that's a success. When you start a conversation, they say a problem shared is half solved. So I feel that if the young people are willing to be part of the solution, then we are halfway there. So for me, that's the success stories. And then we have 60 districts that are doing the adolescent health, that are conducting the adolescent health Indaba across the nation. So if we are able to bring all those issues together and bring back solutions, because the issues that are being raised are driven by the young people. They are also offering solutions to say, okay, we have a problem. I'll go back to the Kalomo one. We have a problem. Our parents are not talking to us. We are unable to talk to them. So you see, they're already telling you the problem and also offering a solution. So then
Exactly.
we are able to facilitate. So for me, it's a success. It's a success story from all the reports that I'm getting. I think
Yeah.
the platform is really doing well, and it was a great idea.
It was a very great idea. And big thanks to our minister, Silva Masebo, TYP. Big
Yes,
thanks to these people
yes.
because you're the main reason why these DAHIs were actually suggested. And I'm glad that they're giving a very positive impact. So I can see there are some comments coming through. So we'll just read a few right now. So we have one from Shana Bonwo, following from Mongu. Amazing. You know how I feel about people who are watching from very far. We have another one from Nyundo. Lukulu is following. Thank you so much, Nyundo. One from Mary, following from Mufulira. Thank you so much, Mary, for always being a part of this show. Christian is saying, following from the sweetest town in Zambia. I can guess that one, Mazabuka for sure. But thank you so much, Christian.
Why do you think it's Mazabuka? It's Chipata.
Come on. No, no. When we talk about sweetest town, we're talking about Mazabuka. That's where the sweetest sugar cane is coming from.
Yeah.
Okay, we have another one from Martina, following from Kitwe. Thank you so much for Kopala. We are glad that you are on the show with us. It's so amazing how we're getting people from all across the country because there's
Yeah.
Mufulira, Mazabuka, there's Kitwe. These are different provinces, but people are able to just catch us live and try to get some knowledge from us. Charity, I'm coming there. I'm coming there. I hope you don't have a patient who's waiting for you outside.
No, they haven't yet come.
Okay. Okay, so let's talk about the Kalomo DAHi, because from what we know, as far as we are concerned, the DAHi is giving a platform for youths to actually bring out their problems and their concerns. So, what are the most pressing concerns or issues that were raised by the young people of Kalomo and Zimba at the DAHi, and how do you think their voices can be, amplified in policy decision making?
Okay, like I started earlier to say, their first concern was breaking the barrier between them and the parents, and
Yeah,
they all spoke on the adolescents who are not in school. They want this information that we had the other day to reach out to them because
yeah,
most information is being reached out to these ones who are in school. So these guys who are not in school, who dropped out, they want
yeah.
this information to reach to them in this fight against the teenage pregnancies, the substance abuse, and on mental health.
No, okay. That's really amazing. Oh, you
And
had something to say? Oh, okay.
yeah, and in as much as we are going to involve these parents and community, I guess it will be of much help. And the platform is there to also help us reach out into to these higher officers in
Mm-hmm.
and where you know how Kalomo and Zimba is. We don't have recreational facilities where these young ones can pop out and interact with each other, or maybe they can have sessions that are productive for them. So if this platform is there to give them or to reach out to the higher officers for them to have the facilities that they want, for the authorities to be there to help them reach out to their parents, the
Yeah.
teachers, the stakeholders there who would come in to help out. And mostly I would say there's much concentration on mostly on a girl child. A boy child has been left out. So if we need to involve the authorities, this platform can be there to help out.
I like that. I like that statement of there is much involvement in a girl child than a boy child, because
Yeah.
actually that was noticed at yesterday's DAHi in Mansa. We realized that according to statistics, most people who actually visit the hospital for HIV testing or STI testing, most of them are females, and males, their numbers were really low. So that should really raise a concern and wonder, like, okay, why do we have so many females willing to do this and the males are not willing? When in the actual sense, when the disease is spread, it comes from both ends, you know. So it's
That's
good that, yeah, I think the local authorities, the health authorities should come in and they help us. We managed to give some suggestions, but we still need so much manpower in order for us to bridge that gap, because everybody needs to get tested. Everybody has the right to help. So we need to make a platform where people are able to do that. Yeah.
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 Mr. Vincent, let's talk about the Chipata Dahai. You don't have any good news to tell us. You're keeping everything to yourself.
No, no, no. In fact, I was giving time to Charity to finish the experience from the high. Yeah, the
Okay.
Colombo one. Yeah. Then yesterday, I almost got shocked, and I'm happy with how it went. Because we have a lot of adolescents in Sparta, and the faces I saw yesterday for the
And
high
a lot of teenage
were new
pregnancies.
faces. Now I'm going
I'm
there.
sorry.
I'm going there. My brother. Yes. So now looking at the first thing was I applauded was the new faces,
Yeah.
like the same people to be coming to speak about the adolescent and young people. Uh, it wasn't okay, but now I found I think 85% were new people, and the same new people, each they came out very very strong and they were open. Where I learned something yesterday, saying, why is it that a girl child who look for family planning after she has missed, like she has
Exactly.
gotten pregnant?
Yeah.
Why do you look for prep after 5 days?
Yeah.
You know you have engaged yourself with someone who's too jumpy, but you look for services afterwards. So that's one of the things that's catched me. Said, oh, okay, but why this is happening? This is what is usually happens. What's the problem with that adolescent and young people? So there was a discussion there. It was a powerful discussion. There was also plenary there where I came to understand that we need to do a lot of sensitizations or the importance of adolescents who are sexually active, the importance of having the family planning.
True.
Also, looking at the issue of sensitization on the importance of PrEP and PEP, because you are
True.
looking for them afterwards. But up time, when time ya Peter, that's when you look for those things. So that's
When
one
it's
of
too
the
late.
catchy things that I had yesterday. Then looking at the adolescents were able to question the district adolescent focal point person and the district doctor, where I say, why do we have shortages of what contraceptives? Why do you give us the contraceptives that we cannot access as adolescents? You're telling us to have pills where we are not able to be using pills. So looking at the charts that was there, it was something that was so educative, and the
Yeah.
adolescents were able to speak. We were able to speak, and something that was so knowledgeable. So we're looking forward with the provincial. So we see how it will go. But there are a lot of suggestions. The availability of contraceptives, all form of contraceptives, and also
Yeah.
looking at having dialogues in communities so that we do a lot of sensitization of the importance of the contraceptives being given before someone is getting pregnant. I think
Yeah.
some of the catchy things that we had.
Exactly. I feel like some of these conversations are supposed to be free conversations that people
Yeah.
are able to have without any fear of judgment. So we
Yeah.
really have to be strong when it comes to sensitization, because prevention is better than cure. If we don't sensitize people now and we start dealing with them when they already have the problem, we are not making any sense as a country, you know.
Yeah.
So it's really good. And looking at how open the youths were at the DAHi in Chipata, do you really think their voices were being heard or valued by the people who were there?
The representative from the district health office, um,
Mm-hmm.
responded on his remarks, saying the concerns are heard and the concerns are real. These are real concerns that young people are facing, the adolescents are facing. So there was a paper that was submitted to the DHO so that we see, there was resolutions that were made that also we are looking forward to see if the provincial adolescent health Indaba, if also that will happen. But there was a resolution where there was also a pledge by the district adolescent officer and the district health office, where they say they're going to look into these issues. Then also we look at the high numbers of teen pregnancies in Chipata. Yeah, I can tell you right now that yesterday when we looked at the presentation, we saw that we have more than 8,000 teen pregnancies. So we're looking at what is the cause. What is the cause? This is just within 3 months. So what is the cause of these teen pregnancies, and who are the perpetrators? So we are looking on that, and okay, what prevention measure are we going to use as a district, as adolescent? So that's why now there was a much of talk of contraceptives and the availability of all kind of contraceptives, which the district health officer praised, say there will be availability in all clinics of all kind of contraceptives, so that adolescents, they choose which one they want to use, not giving them every day, use this pill, use pill, so that they choose which one it will be suitable for them. Yeah.
Exactly. Oh, and I love people who pledge. We'll make a follow up. That pledge has to be.
Yeah, we are going to do a follow-up soon, eh?
We should make a follow up because they pledged in front of
Yeah,
people. There were
yeah,
witnesses.
yeah, yeah.
No, I'm really glad that we actually have people who are able to listen and want to work on certain solutions. You know, it's really amazing. George, our main DAHi, PAHi, RAHi man, we are here.
Yes.
Okay, so how can the DAHi, the PAHi, for those people who don't understand, this is the District Adolescents Health Indaba, the Provincial Adolescents Health Indaba, and the Regional Adolescents Health Indaba. How can these events be designed to cater to the diverse needs and abilities of young people? And what strategies can really be employed to ensure that all the voices are heard?
Well, so thank you once more. So designing the inclusivity of the DAHis, PAHis, and RAHis is crucial for the organization TYP and its partners, cooperating partners. So we need to ensure accessibility by providing, we already have Shedrick here, by providing sign language interpreters, Braille also materials during the events, and a safe space for diverse identities. I remember at the last RAHi, all this was there. And at the other DAHi that I attended, of course, we had young people of different identities or diverse identities, for lack of a better term. So the event basically, or these events are there to empower young people, those with disabilities, to share their experience and a learning commitment from policymakers, especially to put them to task, because, you know, we would go to a hospital, Vincent and Charity might attest to this. You go to a hospital, you'd find that there's nobody to help a sign language, there's no sign language interpreter at the dispensary or even at the point of entry to sort of help direct or just facilitate so that they can easy access of services. So yeah, so we want to ensure that we push this as much as possible so that we could have components of individuals that are able to, or nurses that are able to communicate sign language, as well as facilities or entrances that are easily accessible to people on wheelchairs and the like. So it is a conversation for the nation that has started, and we have to push it as much as possible because it is all up on us So this is what YP basically is championing. We start the conversation, and the rest of the nation can pick it up.
I like the rhyming there. Are we musicians here? We start the conversation and the rest of the nation. We heard that.
We
We
need to
heard
give him the
that.
mic. We need to give him the mic. We don't
I
know.
know,
There's
I know.
another talent.
We need to put him in the studio. These are signs. Okay, so looking at
I was
diversity.
rhyming. I'm sorry. It's yes.
Anyway, so we were
No,
talking
please
about
go ahead.
diversity.
Go ahead.
Yes, right now you talked about diversity, and I think today I would require you to give us a lot of success stories. So, what success story can you give us that talks about inclusivity that happened at the DAHi event?
Okay, so we'll start with the show, the actual show that we are on. I think we've been running this show
Yeah.
for over, yeah, for a long time now. There's always been a person, a sign language interpreter. Shadrick has been the longest serving, and he's one of the most committed people. So away from that, because we know this is part of communication, and we cannot communicate very well if other people are not be able to understand what we are saying. That is part of the inclusivity that we are talking about. So we move it from here, we take it to places like the DAHIs, and the inclusivity doesn't necessarily mean people with different abilities. It also means including programs such as mental health issues. Okay, I was going to maybe move a little bit away from your question to answer it in such a way to say uh, the highs basically are designed in such a way that focuses on um, everybody else being catered for, because we know the communities has different needs and people have different abilities. So my main passion, if I may say, would be to create a DAHi festival, or just a festival that really talks about that deals with mental health issues. Since you were talking about music, now you see you've geared me up. That talks about mental health issues. So would call it, for example, Mind Matters Festival, where we have all these interaction sessions, art therapy, peer-led discussions on mental health, and would feature youth-led workshops or sessions on stress management, self-care, and mindfulness. So I feel these are some of the things that young people today are facing in the community, regardless of your ability or your disability. Everybody is faced with some of these pressures here or there. So I think for me, um, I'll speak with the need the right people. We see how we can have a Minds Matters festival, maybe after there are highs,
Yeah.
something that we could focus on mental health, because it really affects young people and their well-being.
Yeah, I think mental health is actually a problem that people don't realize, you know. It keeps growing and people think it's normal because it reflects itself in
Mhm.
different ways. So it's really important that we make it a topic of priority because so many suicidal cases are going on and most of them are due to very bad mental states, you know. So I love the fact that we are able to create a platform where we can talk about that. So now I'll read a few more comments. I think this will be our last set of comments. We have one from It's Nelly Lopez. Remember, even though problems shared are half solved, but people are failing to share because of discrimination. Facts. These are very big facts. People are really getting discriminated for some things that they're facing. It's Nelly continues again and says, truly, sensitization is really needed, but people in the community perceive family planning in a different way. They feel it's promotion of sex, forgetting that it's happening. I think I mentioned something to do with our society right now. There are certain things we can't run away from because at some point we had people telling us the adolescents they said no sex before marriage. Sex is not good. But where did it lead us? People still continued to do it. So instead of us still trying to pinpoint that and making people do something that we know they won't do, why not just create solutions to avoid bigger problems? So I think contraceptives, condoms, these things should be really educated to, because people are still doing it. Whether we like it or not, people are still going. So instead of us still pushing and pushing, let's just try by all means to protect them.
Yeah,
Yeah.
I guess if we start from first sensitizing the people on the same family planning, I guess they can buy it because they really need to buy on the side effects on the same family planning. They're the same ones, the parents who are stopping these children from coming to test these things. But after these children getting these pregnancies, they bring them again to come and ask us to give them family planning.
Exactly.
Yeah.
Okay, so now, Charity, I have one last important question for you, who is somebody who has worked very closely with adolescents and young people. So, what message would you like to share with the policymakers, the stakeholders, and the general public about the importance of prioritizing youth health and well being?
Okay. To the stakeholders and the higher authority and the community is we really need to work with these adolescents. They really need us because we say they are the future for tomorrow. If we don't get this future for tomorrow on the right track, I guess our tomorrow won't be good. And we really need to invest in these young children, or maybe I would say young adolescents. We really need to invest in them, in that we have to pay attention to both the girl and the boy child. This is truly my cry to say we have concentrated much on one gender and leaving out the other gender. If we put much concentration on both and invest in them, truly have a better tomorrow.
Inclusivity. George
Yeah.
told us about inclusivity. We need to really include both the male and the female gender. Yeah. So, Mr. Vincent, also one last important question for you. I know that you attended both the Regional Adolescents Health Indaba and the District Adolescents Health Indaba. So, what are your thoughts on how these conversations can be sustained and built upon to create long-lasting impact on adolescents in Zambia?
I think I believe we need to make sure that the facilities, when the Minister of Health has approved the budget for facilities, clinics, let the clinics start helping out the things that have been done and agreed in the RAHi or even in the provincial health adolescent Indaba.
Yeah.
What I'm trying to say is there's a budget for adolescents in each clinic. So let that budget also help on the thing that the findings that were found as adolescents. So they help out because it's not every time that we need to wait for RAHi so that we bring out issues so we solve them. So we can start solving the problems from the community based and the RAHi needs to come and cement the things, but not always we wait for the RAHi. If there's no RAHi, what next? Are we going to die with the problems? Right. So I think we need to make sure that the funds that are being allocated in clinics to adolescents, let's use the funds appropriately so that it helps to push the agenda to eliminate the issues of high teen pregnancies, new HIV infections. Yeah. So when yeah, because we can't wait for TYP to be funded or TYP to fund us as clinics to push things. I think that's what I can take. But it's a good experience. It also helped me as Vincent Nyasuru to become a community facilitator where on my own I can go in communities. I do those things. With the knowledge that I got from the provincial adolescent health Indaba and the RAHi. Those information in networking, I got the same knowledge and also impacted to other adolescents so that we made a group where we go around and teach about the HR issues and also referring people here in Chipata. So it was something that brought a great impact in Chipata and brought visibility to a lot of young people. And now others have been given scholarships to go to school because of a simple thing that has been happening in the issue of sexual reproductive health. Right.
Okay. All right, all right. Thank you so much for that amazing submission. It's really impactful and it's really educational. Mr. George, we are here. You've been too quiet.
Mhm. I'm here.
So it's really safe to say that the youth platform has really gone an extra mile in organizing these events, organizing the DAHi, organizing the PAHi, and the RAHi initiatives. What exactly drives TYP to go this extra mile to organize these events, and why is it that adolescent health is considered the top priority?
Okay. So you see, the TYP is all about, is Zambia's number one first, what you need to understand is that TYP is Zambia's largest adolescent and youth network. So of course the organization recognizes uh, that adolescence is a critical phase of life.
Yeah,
Okay. And of course it's marked by significant things: physical, emotional, social challenges. So investing in adolescent health is very important for us because it sets the foundation for a lifetime. Okay, once they say your health is your wealth, right? So once we do this, it sets foundation for a lifetime of well-being and productivity as well as prosperity for the young people. So organizing the DAHis, the PAHis, the RAHi, these initiatives are there especially to empower young people with accurate information and skills to make informed decisions about their health. It is also there to address unique challenges and vulnerabilities that exist,
yeah,
that adolescents and young people face, such as mental health concerns, substance abuse, sexual reproductive health issues. We also do this not just for the love of it, but to foster a supportive environment that encourages open dialogue. That's why we have the Indabas, open dialogue,
yeah,
reduce stigma, and promote overall wellness. And lastly, I think we do this to develop a generation of healthy, resilient, as well as thriving individuals who can drive a positive change in our communities or in their communities. So by prioritizing adolescent health, we're not only improving the individual's life, no, but we are also contributing to a healthier and more productive as well as sustainable Zambia.
Yeah.
And what do you want to say?
we understand why we are the top priority at this point. We definitely understand. Yeah, so
You
we've come to
get
the
it,
end
right?
of our, yeah, we have gotten it. We have gotten it. Okay, so we've come to the end of our program. That was the amazing information that we got. We have three different people, actually, plus me, four, who attended four different DAHIs. And I love the fact that most of the issues are correlated, they are somehow related, meaning adolescents all across our country are facing almost the same things. And us being able to open that platform from them where we can be able to resolve some of these problems has been amazing. Thank you so much for everybody who's logged into our show and been with us through it. I want to say thank you to our guests and our sign language interpreter for being here with us. It has been a lovely show and lovely conversation. Have a wonderful afternoon. Bye.
Bye bye.
Bye.
You.